This lecture will discuss the anatomy of the lungs. This is a medial view of both lungs. We've indicated the anterior borders of each lung. The right lung has three lobes, an upper lobe, a middle lobe, and a lower lobe. We note that the lower lobe is mostly posterior, and the upper and middle lobes are mostly anterior. The left lung has two lobes, an upper lobe and a lower lobe. We note that the lower lobe is mostly posterior and the upper lobe is mostly anterior. These relationships will be important when we discuss the physical exam of the chest. This image shows the hilus of each lung. The hilus could be thought of as the doorway where structures enter and leave the lungs. It is also the location where the parietal pleura is reflected onto the lungs as a visceral pleura. This means that the pleura provides a continuous envelope covering the lungs and lining the chest wall. We show the bronchus, the right and left mainstem bronchus entering the lungs, the pulmonary veins carrying oxygenated blood from the lungs back to the heart, and the pulmonary arteries carrying deoxygenated blood from the heart to the lungs. This image shows the trachea dividing at the carina to enter the lungs, where the bronchial tree divides to supply the lobes of the lung. The carina is at the level of the sternal angle of Louis. This is an endoscopic view of the carina viewed from the trachea. We see the right and left mainstem bronchi. The right mainstem bronchus is larger and more vertical, making it more likely that aspirated material will enter the right lung. We indicate the position of the carina. The term carina is derived from the Latin word for keel, as in keel of a boat. The carina is the site where cough reflexes may be elicited in order to prevent material from entering the lungs. This image shows the bronchial tree. We see the trachea dividing into right and left mainstem bronchi, sometimes called primary bronchi. Within the lungs, the bronchi divide further into lobar or secondary bronchi. 3 lobar bronchi on the right, 2 lobar bronchi on the left. Within the lobes, the bronchi divide further into segmental or tertiary bronchi, which continue branching many times until they reach the alveoli. The arterial supply of the lungs follows the bronchi, and the venous drainage of the lungs drains between the segments. It is important for us to understand structures that lie adjacent to the lungs. Many of these structures leave impressions on the lung. This is a medial view of the right lung, and the artist has drawn the impression made by several structures. We note the impression made by the first rib, and this reminds us that the lung extends above the first rib into the neck. The right atrium also makes an impression on the middle lobe and on a portion of the lower lobe. Through the diaphragm, the liver makes an impression on the inferior surface of the right lung. On the left, the arch of the aorta makes an impression as it arches over the hilus of the lung and passes inferiorly. The left ventricle leaves a large impression on the upper and lower lobes anteriorly. Now that we have discussed the anatomy of the lungs, this would be a good time for you to review the video on surface examination of the chest in order to solidify your understanding of the relationship between the lungs and the body wall.